Hello, everyone, and welcome to the 2022 Southeast Collaborative Online Conference. My name is Lauren Clossy. I am the Continuing Education Consultant for the State Library of North Carolina, and I will be your host today for this session entitled Understanding and Combating Health Misinformation in an Infodemic. This event is supported through funding from the Library Services and Technology Act through the Institute of Museum and Library Services. Please feel free to ask questions or make comments in the chat or interact with other attendees and with the speaker within the Whova app for this presentation. And now I'd like to introduce our speaker for this session, Brandy Tuttle. Thank you for being with us.
Hi there, and thanks. Thanks for joining me in my quest to squash the infodemic curve, but more on that in a minute. Before we get started, I want to make clear that during this presentation, I'm not advocating one website over another, one treatment over another, but you'll get tools to help figure that out yourself. We all have our biases and we're pre-wired to believe things that fit our narrative. My goal is to give you a few tools to help you become an informed consumer of health information so that when you go out into the wilds of the internet looking for something, you find it, that it's accurate and relevant, and secondly, that you work to fight health misinformation in your community, however big or small that may be. My name is Brandy, and I'm a medical librarian at Duke University Medical Center Library. I primarily teach in the Physician Assistant Program and Master of Biomedical Sciences, but I also work with a variety of researchers, clinicians, students, faculty, and patients. Primarily, my work includes providing literature searches for patient care and research. As a librarian, I see how people struggle to find trustworthy information in our databases, as well as just on the internet, and the effects of misinformation. 2/3 of us start on the internet when we have a question about our health, but we get frustrated or confused when we don't find what we need, or we don't understand it, or we have questions about what we found, or it doesn't match what Facebook, our aunt, or a celebrity says. Couple that with some general anxiety about health issues or a pandemic, and it gets easy to slip up and trust or share information that isn't appropriate from a vetted resource or something we don't even understand ourselves. So let's dig in. Today, I hope to help you understand the dangers of health misinformation to public health, learn more about credible health information sources, learn more about evaluating websites and news stories, and identify possible challenges and solutions to combating the spread of health information in your community. If you're here, I trust you know this is important. While it's so common and easy to fall into the trap of thinking if it's on the internet, it must be true, we know commonly it's not. Sure, maybe you still consult Dr. Google. I'm guilty of doing less than ideal searches with my first tab, but I bet many of you have a more critical eye than most. That said, just stop and take a minute to think right now, how do you find and evaluate health information? And do you think that health misinformation has already impacted your life? If so, how? I want to start with a brief introduction into health literacy. If you haven't heard this term before, you'll see a short description from the U.S. Department of Health and Human Services Healthy People 2010. Defined it as the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. The definition of health literacy was actually updated in August of 2020 and now includes personal health literacy. That's the degree to which individuals have the ability to find, understand, and use information and services to inform them. But also now it includes organizational health literacy. And finally, which makes them realize that there are services they need to do to inform health-related decisions and actions. So why do I mention this? Why does it matter? So maybe these are even loftier goals, but I think they clarify a few things from the 2010 definition. And equally important, finally pull in organizations, whether that's a public library, a hospital, a government office, who all have a lot more power and ability than just an individual, which ultimately I think gets us closer to health equity for all. Moving on to health misinformation, which is defined as information that is false, inaccurate, misleading according to the best available evidence at a particular time. That doesn't necessarily imply an intent to mislead or cause harm, though sadly it happens. Health misinformation is not a recent phenomenon. In the late 90s, a poorly designed study, later retracted, falsely claimed that measles, mumps, rubella vaccine, the MMR, causes autism. Even after the retraction, the claim gained traction and continued to lower immunization rates all for the next 20 years. Just since 2017, we have seen measles outbreaks in Washington State, Minnesota, New York City, and others. Health misinformation is also a global problem. In South Africa, for example, the AIDS denialism, a false belief denying that HIV causes AIDS, was adopted at the highest levels of national government, which reduced access to effective treatment and contributed to more than 330,000 deaths between 2000 and 2005. Health misinformation has also reduced the willingness of people to seek effective treatment for cancer, heart disease, and other conditions, let alone vaccines. And that information and so much more is pulled right here from the Surgeon General report, which I've linked. During the COVID-19 pandemic, people have been exposed to a great deal of information: news, public health guidance, fact sheets, infographics, research opinions, rumors, myths, falsehoods, and more. The World Health Organization and the United Nations have characterized this unprecedented spread of information as an infodemic. I'm not sure if that's the first time you've heard it, but I'm a fan, that and infobesity. But while information has helped people stay safe through the pandemic, it has at times led to confusion. Maybe you've had some of that the last couple of years yourself. For example, scientific knowledge about COVID-19, it's been evolving rapidly over the past year, sometimes leading to changes in public health recommendations. Updating assessments, recommendations based on new evidence takes time, but it's an essential part of the scientific process. But without sufficient communication and an appropriate level of health literacy, I would add, that provides clarity and context. Many people have trouble finding out what to believe, which sources to trust, and how to keep up with changing knowledge and guidance. So the graphic above just shows how a few people can radically slow the spread of health information. I bet some of you here listening are those very people. Let's get more gray dots here so we can stop the spread of health misinformation. One major source of information continues to be the news, of course, in all its glorious forms. The process of analyzing news stories is referred to as news literacy. Today, we will focus on evaluating health stories on websites and in the news. The process of analyzing what's presented on the news and online involves developing critical thinking skills to determine how reliable the information is that's presented in front of you, and will help you decide if you should share it. And before we get into that process, I would be remiss if I didn't talk about consumer health. What is consumer health? So according to the Medical Library Association, consumer health libraries and information professionals are a critical bridge for contemporary medicine models that require patients to both advocate for themselves as well as partner with their healthcare providers. That's a lot of work. With the continuously changing technology, the ever-increasing amount of information available, and patients' real need to navigate successfully through the system, librarian services can provide a welcoming space and outreach to educate and inform their patrons. Consumer health information should be free of jargon, medical terminology, and acronyms, and should be written at a level that the average person can understand. Consumer health and health literacy go hand in hand as we seek to improve people's comprehension of health-related topics by providing information in a way they can understand. Knowing that information can come from a variety of sources, the internet, the public library, TV, radio, advertising, or even their friends and family, in the form of maybe anecdotal information like, I drank 2 teaspoons of apple cider every day and my rash cleared up, or don't go outside, you'll catch a head cold, or you'll catch a cold. We need to be prepared to stop any health misinformation as soon as possible while providing reliable and useful information. Oh, search engines. So, okay, personally, I will say I use and advocate for DuckDuckGo, which focuses on protecting you, the searcher, your privacy, and avoids filtering and giving you like personalized search results. So check it out, but I digress. All right, so when we have a health question, most of us turn to the internet and maybe Dr. Google. So that presents us with a dizzying array of websites, right? Each with their own agenda and their own information. The problem with Googling or any search engine is that they're unfiltered, many times popularity ranked as opposed to relevancy. And honestly, their algorithms, though, they're proprietary. So it's kind of a mystery why you get what you get. You might enter diabetes into the search bar, and the first thing you'll get is a sponsored advertisement. Here's a plug to block ads if you can on your computer. Then you'll scroll down and there's literally thousands of websites. No one's going to plow through all those. You can try adding additional terms, and I would encourage you to be more specific, but whoops, add one too many, or maybe put in your whole sentence, which is another topic. But then you have to figure out what did the search engine not like? Or maybe you'll just waste an hour watching cat videos on YouTube. But anyway, so while we're talking about Google, let's talk about some of the things you can do to make your Google search better. So before we even get to the evidence, let's find it. So first, make Google work for you. So most people just go to Google, type in their search word, and go. For example, I typed in diabetes and I got 8,830,000,000 results. Wow, who needs all that? I mean, not even needs. I cannot do literally anything like it. It would take my life. So unless you have ad blocker set up, again, another plug, invariably the first ones will probably be advertisements. Skip those. In fact, I never, even if it's relevant, I won't even click on it if it says ad because I don't want them to get money. I'll go down and find it in the results below. But luckily, I will say Google has tweaked their algorithms so they make more trustworthy and relevant health information come to the top if you're searching on a health topic. But it can devolve pretty quickly still. And it always depends on your search and like if you're signed in and other parameters. So try going to the Google settings and then advanced search like I have pictured here to tweak your search and save your eyeballs from scrolling through too much. So you can limit to the domain of the website. Maybe you'd want to limit to a .org or a .gov. You can and should be more specific in your search if possible. Maybe we could search diabetes or diabetic, and that must appear. And then also the exact phrase of A1C, if that's what you use, and that's actually used as a test to measure your average blood sugar for the past few months, commonly used in the diagnosis of diabetes. But so say then we want to limit to just articles that do talk about A1C, make sure that is included. Doing that, I also did, I limited by language, but doing that got my results down to a whopping 211,000, which is still a ridiculous number, but hopefully these results are at least more on target. You can also decide if you want to look at a PDF only, or maybe you need a PowerPoint or a video. It depends on if it's for you or a consumer, maybe you can decide with them what kind of information they need and can consume on the go. Okay, well, maybe we didn't do that and you might end up on this website. Wow. Okay, so let's just take a moment and look at this website. What is it? What information is it presenting? So what's your first clue or 50 clues that this might not be a website that you'd want to get your information from? And I'm going to put pause in because I know this is a lot to take in. So just have a look. All right, so what jumps out immediately? Was it the font? Was it the colors? Just the website design in general? How about there's just way too much going on, too many topics. We've got urine therapy, the mafia, flat earth, everything. So maybe you can't be experts in everything. But okay, let's go ahead and click on vaccine disease. And what you get is a really long web page with just scores and scores of these kinds of images. Now, I don't know about you, but no matter the topic, these kinds of images or memes float around and get shared all the time. I'm sure you've seen similar things. But I saw no credible information. I didn't see authors, no sources. These are pictures and stories built to cause a response, fear at the very least. Okay, no, I'm not here to tell you what vaccines to take or not. I'm just pointing out that this information is presented in a way that it indicates deception and bias. It should give you pause, and maybe they're trying to motivate you in some other way than just informationally. And there's a huge reason that we as consumers of both information and healthcare should be informed about what we read and share. If you look around on the website, you'll find links to articles by authors who have no formal education in the very thing they offer facts and advice. Much of the claims provide no citation at all. Or there are articles cited to prove something, but a lot of times they've lifted out pieces, which out of context can look very damning and prove a point, but isn't really the point of maybe the research they pointed to. So be careful. Okay. Admittedly, well.to or .to is a pretty glaring example of a health-related website gone amok. Sadly, they're not all that obvious. Some of them look pretty professional and with legitimate information, but it's presented in a way it's almost impossible to unpack the good from the bad and the fear, or the ads and supplements or books, maybe the prompts to sign in and give your email for alerts or newsletters, that you'll subscribe to a year later, but you still get emails. But, most websites are not unbiased or impartial because they want your business, right? Or they want at least your clicks so they get revenue from their advertisers. But if they can make you believe that high dose of something and something will cure something else, or give you a quick link to buy an ebook or download something for free, they'll try. Okay, so let's talk about evaluating websites. I'm going to briefly discuss 3 different models because they may fit your needs at different times for different people that you work with. So let's choose, it's kind of a choose your own adventure here. We'll touch on the Han code, the CRAP test, and the 5 W's. But first, let's just stop and consider the things you already look for when you're trying to determine the credibility of a website. What indicators would you look for to know it's safe to proceed into an unknown or maybe foggy place? And what do you tell your patrons to look at or family? All right, so maybe some of these kinds of things came to your mind. I mean, do you look at the about page? Who made this? Do you look in the header, the footer? What does it mean to you if the website doesn't look very professional? Maybe it's just the ability to pay for a website designer. Maybe it means something else. What if it uses pop-ups? Can you navigate the site easily? What's featured most prominently? Like, are they trying to sell you something? Is it obvious? And then how much of your personal information do you have to provide to get something? Like, do you have to log in to get that free ebook, or maybe access to the full article, or more access to the website or newsletters? Really, what are they selling? How does it make you feel? So now we'll talk about the quick ways to evaluate a website, because we don't always have the time or ability to do some massive investigation on every website we click, right? And honestly, it's probably easier to just find a different website if you're that unsure. Okay, so luckily there is one easy way. Look for the Han symbol, usually at the bottom of a web page. This is a symbol for the Health on the Net Foundation. Health on the Net, or HON code, is a nonprofit organization that works with the World Health Organization to identify and promote quality healthcare resources on the internet. Health websites can be certified by adhering to the 8 principles listed here on the website. Honestly, all these principles should be easy to find on a reputable health website, or really any website. Okay, so authority. So the information presented should be from trained, qualified medical professionals, unless clearly stated otherwise. The information presented should be used in support of and not in place of your healthcare provider, right? This is you working with your healthcare provider. The website should treat all website visitors' information confidentially. Hopefully there's some kind of policy they'll talk about in the bottom with cookies or privacy policies. All sources should be cited, hopefully with links. Any information related to potential benefits will be supported with appropriate and balanced evidence. If they only have one side, be wary. All sites should disclose financial support. And finally, they should be clear if there is financial support, does it come from advertising and ads? And if so, those ads should be clearly discernible, not something embedded that makes it seem like it's going to give me information, but oh, actually it's an ad for a product or something. So no tricksies, right? Just straight up, be very transparent and clear about who and what's going on with this website, and you can get a Han code. Okay, another tool you may have heard of is the CRAP test, developed by Sarah Blakesley at the University of California's Chico Merriam Library, and I put the link below on her article. So this is a series of questions you can work through on the currency, the relevance, the authority, the accuracy, and the purpose of a website. It can be used to kind of quickly glean the credibility of a website. While I admit it's always fun to be able to insert certain emojis on a website, I do find that this model resonates with certain populations and some of my students better. So you may use the CRAP model with that population instead. Or maybe you like to just say the word CRAP in a presentation. I'm a medical librarian, so we get to say all kinds of stuff. Okay, so finally, we have the 5 W's as another quick way to evaluate health websites. Okay, who? Who's the authority behind this website? Like, who authors or collects the information? Can you find any information about who's responsible for the content? Why? Why does the website exist? Is it here to provide information, or is it trying to sell you something, maybe teach you something? Maybe all of the above, but they should be clear about that. What information is on the website? What information is the website taking from you? Do you have to register to access the content or all of it? What will they do with your information also? Where does the information get its information? Do those authors have any kind of credentials? Do they cite the articles they're using? And then finally, how up to date or current is this website, right? When was it last updated? I want to make sure I'm not going to dead links or something that, sure, maybe 5 years ago we thought that, but now it's been disproven or debunked. Let's make sure we update our information fairly quickly, especially with health information. Okay, so let's look at a few websites. Here's one that you may be familiar with, WebMD. Comes up in a lot of Google searches because it's seen as a fairly, I won't say innocuous, but a fairly benign website for health information, at least by Google standards. Okay, so first of all, you may notice it's a .com, so it's a commercial enterprise, so there likely is going to be advertising. When you look at the front page, there's a lot going on. There's a lot of topics, everything from the best foods for my liver to how to clean my bathroom. I mean, I suppose it matters if you're going to this page, if you have something specific in mind, like, okay, my aunt's being diagnosed with diabetes, or maybe you just want to browse around and not look at cat videos, then maybe this serves a purpose. Say you are interested in diabetes. You'd probably either go to the search bar up in the top corner, or maybe you'd go to the Health A to Z list. Let's search first. All right, so when I searched for diabetes, the first 3 results are ads. Boo. After that, there are links for information, but they don't appear to be super organized in any real fashion. So I have my entry on diabetes, and then I have an entry on skin problems and diabetes, and then more general information, and then ads again, and it kind of goes back and forth. If you go up to the Health A to Z list, you'll see the commented conditions pop up, which puts diabetes as one of them immediately available, even if you just hover over it. Or you can click and go alphabetically. So while the Diabetes Health Center, that page puts more useful information, it's better organized, it's right at the top, there's still a lot of junk to sort through, and you're surrounded by ads. So keep that in mind. If you don't have an ad blocker on, I turn mine off to show what I feel like a lot of people see is just all these flashing websites telling me that I need pants and I can get some maximum pain relief with lidocaine. You know, neither of those talk about my aunt and her diabetes problem. So, all right, if you scroll to the bottom though, we're going to try and do a little bit of our evaluation. I see a privacy policy. I see a cookie policy. That helps me know how they're using my information and if there will be snacks. No, I'm just kidding. Sorry. Cookies are about your information. But I also see an advertising and an editorial policy, which is good. And if I click on the About link, I can find who's responsible for the content, and I see that they're all MDs. There's a link to contact them. I can also see that the site was updated in 2022. And there at the bottom is my HAN certification. So aside from the ads and lots of content provided, it's fairly easy to navigate. So while I don't usually use or promote this website, it's not a terrible choice. Okay, so now we're at Medscape, another very popular website. So first up, what are your thoughts on this site? I like that it's a lot less cluttered. Seems to be focused right away on those. You can explore some drugs, procedures, anatomy. Seems like there's some less marketing, at least in an obvious way. Scrolling down, I'm pleased to see they have academic partners. So these are partners willing to put their names and reputations here. There's an advisory board, an editorial and privacy policy, similar to WebMD. All in all, I say I feel pretty good about digging into this website. Okay, Medline Plus. Let's look at a good resource that I just must mention. It's published by the National Library of Medicine, Department of the National Institutes of Health, and the URL is a .gov, so it indicates it's a government-sponsored website. The homepage has, I think, very clear navigation. It's available fully in Spanish, but it also has a lot of other languages for at least some of the content to download. It's curated by medical librarians. I may be biased, but they're pretty awesome. It's updated consistently, offers easy to read materials. And earlier, as we talked about with health literacy, this is a really important feature. Most medical information is written at a 10th grade level, but most people read around an 8th grade level. But for maximum understandability, consumer health should really be at around a 4th grade level. And while the search of diabetes in the search box still gives us, more than 4,000 results, those results only show up if they've been from licensed outside sources or from already content created within house. And all the content is updated regularly. All in all, this is a wonderful resource paid for by your tax dollars, I might add. So I encourage you to use it and promote it. And also, I'll just go ahead and point out that you may want to use or just promote a tutorial on evaluating health information developed by the National Library of Medicine and Medline Plus. So this tutorial teaches you how to evaluate health information you find on the internet. And it's divided into 5 sections, so you can kind of bop around. And if you have a patron that doesn't want to or can't do the tutorial on a computer, you can also download the tutorial and print it. And then they also give you a checklist available to evaluate online health information they can use. So it's great for even the population that needs to leave and you need to give them something, at least they can leave with something. Okay, we don't have time to talk about all the other great sites and kind of dive into them, but I wanted to at least mention some additional websites for consumer health in case you haven't seen or heard of them. And then if you're really, really interested in research right from the source, though it can be like drinking from a fire hose, honestly, there's PubMed. PubMed is a freely available biomedical database, though no, not all the full text is free, most of it isn't. It indexes over 33 million citations. And if you really need to get that in depth, I would encourage you to reach out to a medical librarian like me or someone close to you to get started, as using the control vocabulary called MESH, it can be really helpful. So happy to help you get started. Okay, turning now to the side, since hopefully most of you don't need to delve into PubMed very regularly, let's stop for a moment and think about some of the places you generally get your health and your health news from. What hits your eyeballs? Maybe not daily, but what health news do you see and where does it come from? All right, did any of these come to mind? Maybe you also thought of Twitter, Facebook, or some other social media, but where did those posts like generally take you? Probably to a news outlet, a blog, a website, or something. We've talked about how to evaluate websites, but let's dig more into the news media side of things. So first off, you see this health news. How do you evaluate it? Do you use different criteria? Would you still use the CRAP test? What criteria do you use, or what do you teach others? How do you tell them to have a critical eye when it comes to news? Thinking about that, it's certainly reasonable to use the 5 W's or the CRAP test. They won't come with a HAN code, but it's always a good place to start. But we're going to talk about a few other methods. All right, but first let's start with a basic science journal article with a title nearly unintelligible to a layperson like myself. It discussed the development of a compound called AP39 that in laboratory experiments delivered very small amounts of hydrogen sulfide to mitochondria, cells inside, inside your body. So not even within animals at this point, we're just talking on a cellular level. And there are some positive effects on the mitochondria. So I won't even ask what you think here, but the question remains, how do we get from this article from the researchers report to what the public reads, which is smelling farts could reduce your risk of cancer? So it kind of makes my head explode right here. So digging into that too a little bit, like how does that kind of thing happen? And how does it happen over and over, right? So let's think about the sources. And when we take a look at where health news stories come from and the reasons why some of the stories may misrepresent health research. So when you read about health news in the news, you know you're not reading the original primary source. We're not scientists. The information has been interpreted and summarized for you by journalists or freelance writers. Those news agencies I mentioned earlier are examples of major news aggregators in the US. They have a budget and a staff. You may recall seeing articles like from the AP, the Associated Press, and your local newspaper. These agencies have people trained in interpreting health and other scientific studies. And keep in mind, though, that the smaller the scale of the agency trying to interpret, the smaller the budget and the staffing. And so their job is really to take the research articles, the conference papers, press releases, oversight agencies like government and other policy and WHO and CDC, and then take it and translate it in something that is easily digestible by you. So that makes this comic a little easier to understand how this happens, how we get from mitochondrial research to fart smellings for prevention of cancer. So, when a researcher, this comics kind of describes, I think, the process beautifully, where, their research that comes out. So maybe the university blasts, hey, look at our lovely and smart scientists that just did this awesome research. And a newswire picks this up and they're like, oh, let's go talk to the scientists. And maybe they say something, it's picked up by the internet, it's kind of twisted, and oh, wow, oh my gosh, here's a comment on this and some thoughts and opinions. And then now the cable news is maybe they're looking at the original research, but they're probably looking at that news wire or the press release from the university. Then they're looking at some of the comments, and now they're gonna, oh, this causes X. Wow, and that goes to your local news. Oh my gosh, did you know that this? Stay tuned for more at 11, and all of a sudden your grandma's wearing a tinfoil hat or something. But so it's pretty extreme, but this is kind of the process, right? So it's not a harmless game of just telephone though, right? There are some other major reasons why it can happen, and it can be dangerous for sure. But let's look. So first of all, let's imagine though that this story on farts, smelling farts causing preventing cancer, it's been debunked. It was debunked in 2014 when it started, but the spread of it continues to happen. So how does this story that was debunked, but it still keeps getting picked back up and recirculated from time to time? Why do you think this happens? Why are we having different news and journalists talking about it in 2017, 2018, 2019, 2020 even? What do you think? Why would they talk about it again? So maybe you think, well, maybe they never saw the fact that it was debunked in the first place. Very possible. Maybe there was just a less newsy day. Maybe there's also just, hey, we need to generate some cash. We need to drive more clicks to our website. So people are going to click on this, right? There are those topics that people will click on. And all of those clickings generates revenue from their advertisers generally, because then you will see their advertisements when you click on their site. So again, block ads if you can. Okay, so no health news story is perfect. However, developing the skills to help you identify some of the common reporting issues can help you critically analyze claims in the news. So the next 2 pages are going to list some specific questions to ponder. So think about, does the health news story adequately discuss the costs? Does it quantify the benefits? What data do they have backs it up? How big was the study? Does it adequately explain or quantify the harms? Do they even talk about adverse effects? No one wants to hear that, oh, this is going to save you, but what about the other things that it does to you? Does it grasp the quality of the evidence? Like, what kind of study was it? Was it a randomized controlled trial? Was it just a case series? Was it just one person? Was it even a study on humans? Or are we looking at rats and mice again, or mitochondria? Does it commit to disease mongering? This is an ugly kind of thing where, does it exaggerate or sell a condition? Does it exaggerate the consequence, saying millions are suffering in silence? Or does it offer a worst case patient and make it seem like that's a representative patient? Does the health news story use independent sources? Are there financial or other relationships that can insert bias here? Did the information come from the drug company? Does it compare a new approach with existing? What are the current treatments? Why do I care that there's this new approach if the old ones are working? Does it establish the availability of the treatment? A lot of times you'll see these things, they're not are ready, or they've not been FDA approved. They're not ready for public or human consumption. Maybe they still are just testing in mice. That's years away from us ever seeing that. Is it actually novel in the approach? Newer isn't always better. Has this been studied before? Didn't we already determine that smelling farts doesn't prevent cancer? And then finally, does it appear to rely solely on a news release? Maybe this was just spun up from another news story that doesn't actually link. Is it so far away from the actual research that started this? Think about that comic and how many translations the message has gone through. You know, it sometimes, if it seems to be true, like too good to be true, it might be. You know, so journalists aren't the villain. I mean, they face many challenges and like the pressure to publish quickly, competition. Maybe they only have biased sources to look at. Maybe they just don't understand the health research they must write about to get a paycheck. That pressure to rapidly release news stories contributes to the misinterpretation of information a lot. And then the pressure to keep stories concise for public consumption, that can lead to omissions that are important to the context of the study. And this content's often picked up by media outlets. They don't verify the information, and then suddenly something is rapidly distributed that's inaccurate or untrue. And then there's always clickbait, which just generally uses sensationalized headlines on high interest topics. It grabs their readers' attention and their clicks. And really what tends to be over reported is things that emphasize like the benefits, and it overlooks the side effects and other variables. So think about what they might not be talking about too. You know, and news media has gotten a major boost from social media and competition too. I mean, if you take a look at this news story, shared over 1 million times just in 2018, that's a lot of reach. In the past, news was just produced by a third party, like an editor or publisher, and then distributed. This was known as mass media. You read the news, there it is. Today, anyone can generate this content. And there's a lot of different social media platforms, Facebook, Twitter, YouTube, Instagram, TikTok, and more coming, right? So this user-generated content contributes to an overall rise in information and the consequences of a rise in information that's published that hasn't been independently verified, right? And it can be difficult to distinguish news from opinion on social media. Locate the original source if you can get to the full text, to determine if the story has any accuracy. If you can, you know, when you dig into a story like this one on marijuana, you'll see that there's only one study on this topic. The research was only conducted on animals, and it doesn't address the risks at all. Is this maybe another case of too good to be true? Or maybe we just need more research, of course, and more than actually have somebody that's going to take the research and synthesize it for us. Okay, so that's my all seem daunting, I know. Just know awareness is growing. There's lots of health news stories, evaluation organizations currently out there. They're working to debunk inaccurate reports. And you can always visit these groups to see if there's something that has been debunked. For example, you might have heard about the cancer-fighting properties of corn tortillas, reported by several news outlets, debunked by iMedia Ethics, and they took it down. But we'll see if that one comes back up. So earlier I mentioned Twitter, which can both serve up misinformation as well as the critics of that misinformation. So here we have, this was actually just yesterday. This was on February 24th, 2022. But StudyFinds.org, a Twitter user, tweeted about teen boys vaping having heart problems. While their actual study states that it's in mice, their tweet failed to mention the study was in mice. But hey, it got clicks. And too easily, that thing can get reshared with a simple click. And sadly, people will literally read a headline, stop there, and just start believing and sharing that information. That's dangerous. I appreciate and want to point out, there's a Twitter user, Justin Mice. They will post articles like this with just a comment in mice to appropriate stories. Well, it's a small contribution. That's more than I do. And then you'll see the Twitterverse really starting to poke more at StudyFinds. It's nice to see with those out there with a critical eye, and I encourage you to find them, follow them, and follow in their lead if at all possible, or at least reshare. You can retweet their information, even if you don't have that kind of information or you can't come up with it yourself. So it's nice to see when people do kind of, I sometimes say don't read the comments, but sometimes it's worth it, especially when you see misinformation debunked. Okay, finally, I don't want to forget about our beloved celebrities. Okay, sure, a celebrity endorsement can bring more awareness, can reduce stigma associated with the disease, or they can straight up give money like Dolly Parton did to fund a COVID vaccine. But celebrity endorsements do not usually target those most at risk for a specific health condition, or they may be endorsing that is something that is completely unnecessary, maybe even dangerous, because they benefit financially from it. Something like Gwyneth Paltrow and her Goop website, right? They can often spread misinformation about a health condition, test, or treatment way too easily because of their name. So be careful. Okay, now that you have some tools on your belt for evaluating health information online, let's turn towards a bigger issue of health misinformation in general. We know that health misinformation isn't a new thing, but with constant new ways to communicate and share information, and in the middle of a pandemic, no less, stopping the spread of misinformation is crucial to the health of our communities. Luckily, there are a lot of big and little organizations out there trying to tackle this and provide you with support and direction. I've put some of the many available infographics and resources up on, one is up here right now, and you'll see listed below, listed later on the topic to get started. But first, I want you to stop and consider, what are your challenges? Think about what challenges you've already had or what you think you'll have when trying to stop the spread of misinformation in your community, or maybe even just your own family and friend circle. So while I'm not sure of your list, let me share a few solutions, as undoubtedly others have had my issues and probably yours too. I want us all to be part of those gray dots. So listening to and engaging with your community are just the first steps. You'll likely need to find some partners, maybe to help you dig into the science. It can be hard, maybe to help you spread the word. So stop and think about someone right now that you can collaborate with, near or far. Hopefully digging into some of the resources together, having a buddy to help work with, to help brainstorm and get started. Start small. Remember that the power of the infographic is great. Even that one person that chooses not to hit share, chooses not to spread it, is powerful. So even if we stop a few people, the effects down the line can be great. All right, that's it. And that was a lot. So thanks so much for attending. I hope you feel better equipped to evaluate health websites and news sources and are ready to help stop the spread of health misinformation.
All right. Thank you so much, Brandy. That was excellent. And if you have any questions, please feel free to reach out to the speaker or the conference hosts using the Whova app, and an evaluation will be provided in the conference resources. And we welcome your feedback about this session and about the conference. So thank you for making the 2022 Southeast Collaborative Conference successful, and we will see you all next year.